I think we're going to go ahead and get started. I want to welcome you to this afternoon's webinar. My name is Sarah Johnson. I'm a faculty member at the Johns Hopkins School of Medicine and Public Health, and I co-direct the Rails Center for the Integration of Health and Education at Johns Hopkins. And I'm also pleased to be a member of the eSchool Plus initiative. I'll be the moderator for our discussion today. And this is the last installment in a 7-part webinar series on equity in K-12 school reopening. Today, we're going to be talking about school-based healthcare in the era of COVID-19. This is really, I think, a critical conversation because schools are the setting for a variety of health services that kids receive throughout the year. And it's going to be critical to determine how best to meet their mental and physical health needs, both during the remote learning phase as well as when children are back in the classroom or in a hybrid environment. So before we begin our discussion, I would like to extend a very special thank you to our sponsors today. So that's the Johns Hopkins School of Education, the Johns Hopkins Consortium for School-Based Health Solutions, the Berman Institute of Bioethics, and the Rails Center for the Integration of Health and Education. Our format today will consist of 3 brief presentations, and then we will have a brief discussion, and then we'll open it up to you, the audience, to participate in Q&A. And you can do that by using the chat or the Q&A function. Feel free to type your questions in as our participants are presenting, or afterwards we'll prompt you, remind you to go ahead and enter questions as they come up, and we'll get to as many as we possibly can. So now, before we begin, I want to briefly introduce our 3 panelists for this afternoon's conversation. Their bios are long and illustrious, so I'm sure that I will not do them justice, but I will briefly introduce them to preserve time for what I hope will be a lively discussion. So our first participant and panelist is Dr. Danielle Dooley. Dr. Dooley is Medical Director for Community Affairs and Population Health in the Child Health Advocacy Institute at Children's National Hospital in Washington, D.C. We're pleased to have her join us. Our second guest is Dr. Kate Connor. Dr. Connor is Assistant Professor of Pediatrics at Johns Hopkins School of Medicine, and she is the Medical Director of the Rails Center for the Integration of Health and Education at Johns Hopkins. And finally, our third presenter will be Dr. Nancy Lever. Dr. Lever is Associate Professor and Co-Director of the National Center for School Mental Health, and she's the Executive Director of the University of Maryland School Mental Health Program. So I'm really looking forward to this discussion, and I'd like to go ahead and get started with Dr. Dooley. So the floor is yours.
Thank you so much for having me today. It's a pleasure to be here and participate in this incredibly important webinar topic. And I bring to this my background. I currently work at Children's National Hospital. Before that, I worked for 10 years for Unity Healthcare, which is a large federally qualified health center network in Washington, D.C., where I was medical director of their 5 school-based health centers. So school-based healthcare is really my passion, and really, I think, just such an incredible service to our communities and an important part of our communities. I'm going to start today by doing a little bit of an overview of school-based healthcare in order to set the stage. And before I get started, I'd like to invite people to type in the chat box just some ideas of what types of services come to mind when you think of school-based healthcare. And we'll give people a couple seconds just to type that in the chat box. All right, well, I'm not seeing any responses in the chat box, so we'll go to the next slide. And what I want to convey is that school-based healthcare offers an incredibly wide variety of services, from school-based health centers to school nursing, to school-based mental health programs, oral health and vision services, speech, occupational therapy, physical therapy, telehealth, health education, case management, and much, much more. I'm sure there are things people could come up with in the chat box that we haven't even covered here. And today, if we go to the next slide, I'm going to focus specifically on school-based health centers. And I urge everybody to check out the National School-Based Health Alliance census, which is done every couple of years. It is a really complete data collection of school-based health centers across the United States. And due to decades of advocacy, the number of school-based health centers has doubled since the 1980s, such that we now have over 2,500 school-based health centers across the United States today in 48 out of 50 states, plus the District of Columbia and Puerto Rico. And if we go to the next slide, so school-based health centers play a really important role in reaching populations that may have challenges in accessing care or be in under-resourced communities. So you can see from this slide that schools with access to school-based health centers serve a higher number of students who identify as Hispanic or Black compared to schools without access to school-based health care. And if we go to the next slide, and also schools with school-based health centers serve a higher number of students eligible for free and reduced price lunch. And if we go to the next slide, and there's also a really important geographic distribution. And if you follow the light brown band across the year, you can see that real growth of school-based health centers in rural communities between 1998 and 2016, a 10% increase in school-based health centers in rural communities. And if you go to the next slide. And it's important when we talk about school-based health centers that we of course think about their outcomes, which have been really nicely analyzed in a number of studies and then summarized in this health affairs article, which I've referenced below. But there are medical outcomes, including increased preventive screening services and vaccinations among school-based health center users, increased use of contraceptives, increased access to and use of mental health services, decreased morbidity due to asthma, decreased emergency department use and hospital admissions. And then critically, school-based health centers have also been shown to improve academic outcomes. So improved GPA and rates of grade promotion, and an improved experience of school life and feeling connected to schools. Next slide. So as we think about school-based health centers and COVID-19, it's really important to remember their critical role and that of other school-based health centers in our community. And it's really important during this time of COVID-19 that we consider some of these key challenges, which include access to school-based healthcare when our schools are closed for distance learning, outreach and how we are maintaining contact or making contact with students and families that have been served by the school-based health centers. In terms of funding, most school-based health centers have funding from either a federally qualified health center grant, some private philanthropy, a local Department of Health grant, or some federal funding. And of course, all of those grants come with deliverables that people have to manage in the era of COVID-19 when students aren't physically present in school. And then I hope that you've seen through these brief intro slides the really important role school-based health centers play in advancing equity and how they are a lifeline for some communities and populations that may not otherwise have access to care. So with that, I want to turn it over to my colleague, Dr. Kate Connor, who's going to really do a deep dive on how a school-based health center has adapted in the era of COVID-19.
Thanks so much, Danielle. So I am going to talk through a little bit of sort of an example, an illustrative example of a school-based health center in COVID land. I'm going to use the school-based health center program that I work in, the Rails Health Center at KIPP Baltimore. We're really proud of the work that we've done, and we think we've been able to identify some common themes that may be common to other school health programs as well. That will be helpful for a jumping off point for our discussion. But I do want to acknowledge that every circumstance is different, and each school and school health program will respond individually and in a tailored way to their setting. Next slide, please. So I always like to orient conversations about school health in the WISC model. This model really outlines the components of a whole child approach to health and education and integrates coordinated school health program components and the whole child educational approach. And we build our services and programs at the Rails Health Center on this model and this structure. And while many of us may be returning to schools in a virtual environment, these are still the key pillars and components of an integrated school health approach to support student wholeness. Next slide, please. So when schools closed in our area in Baltimore in response to COVID-19, we really started thinking about the roles that we could play and how we could support the school community. We came up with some pandemic specific opportunities. They included collaboration with the school around their discussions about closing and reentry planning, COVID education for the entire community and a variety of stakeholder groups, health advice, specific health advice and linkage to primary care. Danielle highlighted how critically important school health programs are and how they can serve as a lifeline for kids who have limited access to care in other settings or barriers to their care access. And so we really wanted to make sure that those kids were not left without a safety net when school closed. We collaborated, back to the last slide, please. We collaborated with the school on individualized continuity of learning plans to support students. Our wellness team really dug in on social emotional learning and support in the distance environment. We worked with the mental health clinicians in our building on mental and behavioral health crisis response and tried to do a good deal of case management and screening for family needs. Now the next slide, please. We really wanted to highlight and prioritize, making sure that our kids had access to emergency medications, that they had continuity in their chronic disease management and opportunity for preventive care, as well as continuity in mental health services that they were receiving in school prior to closures. Next slide, please. So those were sort of our priorities and the areas that we tried to identify. I should take a step back and say that at the Rails Health Center, we operate a comprehensive integrated school health and wellness program that is situated in and in partnership with 2 large public charter schools in West Baltimore. We operate wellness as well as school health services or school nursing and a school-based health center. And our approach is very population-based and integrated. So I'm going to talk about a lot of different things here, some of which fall under our school-based health center and some of which fall under other components of our program. And I'll flesh that out as I go through. Some general considerations that we thought were important as we sort of phased out of our springtime in virtual learning and into, I'm loath to use the term new normal because I've heard it too much, but into our new state of being as we think about how to reenter school. And we really thought that it was critically important for schools and school-based health centers, school health programs to be informing and supporting reentry protocols, to support primary care capacity. So we know that during the pandemic, there have been substantial declines in immunizations and well child visits for children. And that is partly due to the ways that primary care practices had to adjust to dealing with the pandemic and implementing health and safety protocols that limit the number of people they can see at a time or in what ways they can see them. And it's partly due to families' concerns about going out in public with their kids and particularly to a healthcare facility. But that's a really critically important point that we want to make, and we want to make sure that that primary care capacity is supported with every opportunity. We also thought a lot about early activation of school-based health centers and school health programs. So as everyone is spending the summer trying to frantically plan for the best way to return to school, whether it be in person or digital, we thought that it was really important for school-based health centers to be able to open. So as soon as school buildings are allowed to be open, if school-based health centers can open and be physically present in buildings, then we would have the opportunity to begin to deliver services like vaccines and checkups that kids really need, not only for their general health, but in some instances for school entry, vaccine requirements, for example. We also are continuing to think about how we respond to COVID itself what is the role for school health programs in contact tracing, testing, and potentially administration of a COVID vaccine when it becomes available. Oh, next slide, please. So as I think about this and talk with my colleagues in school health, it seems that the ability to have a robust school health response to school closures and the kind of re-entry planning that we're doing right now depends on a variety of factors, both at the program and at the system level. And Danielle already highlighted some of these. In particular, school health programs need to be adequately funded. As with many things in the course of this pandemic, we're unveiling areas where disparity and inequity have always been, but are really becoming quite pronounced. And in many instances, school health, the education system, and the public health system have been underfunded. And now we're trying to support sort of an entire structure of sending children back to school on those functions. We need to make sure that school health programs have adequate and robust staffing, not just because people may be going in and out for illness, but because there may be redeployments. So Danielle mentioned that there are a variety of different sponsors of school-based health centers, for example, local health departments. And if you work for a local health department and the building where you normally work is closed, then it seems rational for you to be redeployed to something that can be, really effective part of the COVID response. We want that to be able to continue, but we also want to make sure that critical school health functions are able to continue. Multidisciplinary teams are really important and effective in helping to facilitate robust school health response, school integration, an existing population health infrastructure that can include an electronic health record, for example, and telemedicine technology, a way to reach our students remotely when they're not in the building. At the system level, in addition to funding, there needs to be a clear line of authority and communication about how school-based health centers and school health programs can pivot and adjust their operations in order to support kids during school closures or in a distance environment. And there needs to be a good amount of technical assistance and support, monitoring of the changing regulatory landscape, and a whole lot of flexibility and multi-sector collaboration. Next slide, please. So at the Rails Health Center, we really have tried to build upon our population health approach and our multidisciplinary collaborative team to implement and begin to think about some creative solutions to serving our kids in a distance environment, specifically because the district in which we work has announced that they plan to return to school virtually in the fall to begin. Next slide, please. We have a robust wellness and parent engagement team. And this slide highlights, for those of you who listened to our webinar back in May, I talked about some of our sort of planned responses during COVID closure at the Rails Health Center. And I've included them here, but also highlighted in purple some areas that we have built out to try to include in our new sort of fall reopening plan in response to the virtual environment. So our wellness team's main focus is ensuring that rigorous SEL curricula continue to be implemented in the school, in the distance learning environment, and that we are using trauma-informed approaches, restorative practices, and evidence-based health education. We are in the process of also thinking about engaging parents and families around what kind of support they really want from school health programs in a distance learning environment. Next slide, please. School health services is tricky because it is very clear that when a child with diabetes is in the school building, that child needs to get their insulin and that the nurse who has an order to give it is going to provide it. When children are not in the school building, they don't have as much access. So the great thing about school nursing is kids can walk in anytime and access a health professional. They can ask them their questions, they can be listened to and supported. And when they don't have that ready access, they may be at risk, particularly if that school health professional is a real unique source of support for them. So we are thinking about ways to make ourselves available virtually to our students. One idea that we're beginning to think about is a virtual health suite where we would try to have students be able to access our nurses in a virtual environment. We're also thinking about ways to include some of our directly observed controller therapy programming for asthma, so a chronic disease management support program, in a sort of remote virtual approach to school health. Next slide, please. This slide, this morning, I was at our school-based health center, and before I dive into school-based health centers and our response real quickly, just wanted to show this picture of our great team, physically distanced and in PPE, ready to vaccinate and provide well child care for students. So we are really excited that our district is committed to supporting kids in this way and has allowed us to reopen in the school building so that we can provide those services to kids over the summer. Next slide, please. So I want to make sure that our next panelist has plenty of time. So I'm just going to quickly touch on the fact that school-based health centers can do a lot in a distance environment. I think there's been a great deal of discussion about telemedicine, both in school-based healthcare and in private or primary care practice. I think what we didn't think about as much during the time when many of our places of work and many of our communities were in sort of COVID phase 0 or 1, where things were so bad that we were really not wanting people out and about at all. Now that we've started to do some targeted reopening, I think it's critically important that school-based health centers and other school health programs are included in that first line of programs that are allowed to reopen in the community, so that with appropriate safety protocols in place, we can continue to serve our kids and fill gaps that began to appear during the closure when kids didn't have as much access. Next slide, please. So I just wanted to highlight again our facilitators of a robust school health response. Next slide. And highlight a couple of lessons learned. So that was a whirlwind tour of the types of activities that we have been doing at the Rails Health Center, just as some sort of thought-provoking ideas about the ways that school-based health centers can serve kids and communities at this time. A couple of things that we've learned. Trust and integration are key. Integration with schools and trust from the school community really made it so that when I went to our principals and said, how would you feel about us being open over the summer to serve kids? They said, well, of course we want you to do that. Creativity is needed in a lot of aspects, but in particular in thinking about how to provide confidential care to adolescents for things like reproductive health services. Family preferences continue to evolve. So when we first started, our families, when we first started reaching out to people during closure, they really responded by saying they were so grateful for this contact and connection with resources. As that time went on, they sort of started to feel like, yeah, we're out of school. We've got things okay right now. And now as we're planning school reentry, we're hearing again that people want more contact, more information, more outreach from us. So continuing to collect feedback and information from your school community is really critically important. I want to hit on 2 quick points before I end that are really critical. The first is that access barriers remain. So we were a school-based health center that was able to launch telemedicine quickly and is able to be open and delivering services over the summer. But children do not just have to walk down the hall to get to us. They have to come from their homes. And school-based health centers are so powerful and effective because they are place-based. And so some barriers will remain to school-based health centers being able to access students and deliver the services that we typically do when our kids are not in buildings with us. And finally, on any platform that I am given these days, like to really highlight the fact that schools and school health programs have to be adequately supported and funded in order to implement the kinds of protocols that we are calling on them to implement to return kids and staff to school safely. And so I just really want to highlight the importance of that as we think about how we move forward in bringing folks back into school buildings. All right, thank you very much for your patience with that whirlwind. I will turn it over to you, Nancy. Thank you so much.
Thank you, Kate. And I guess I will continue the whirlwind. We've heard about school-based health centers. Now we're going to talk a little bit about the role of school mental health. But the good thing is when this is done well, our school mental health and our school health work in collaboration. And in terms of providing school mental health, it often works best when you can integrate it into school-based health centers and working in collaboration with our school nurses. Next slide. So I've been fortunate for the last 25 years to be with the National Center for School Mental Health. We have been funded by the Health Resources and Services Administration, and our focus is really on advancing research, training, policy, and practice in school mental health. And we're very much focused on a family, schools, community mental health agenda and want to work with our family, schools, and communities to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. So we have a foundation for doing school mental health work, which is great because when you're handed a pandemic, it's nice to know that you have a foundation and best practices for how to do this work. Next slide. We have a website, schoolmentalhealth.org, where we keep all of our resources. What we ended up doing is we've added 2 tabs, one on COVID-19 and also one on cultural responsiveness and equity. And as we've been moving forward since March, we have been working to figure out how to best integrate with what we need to do now with what we've always been doing and figuring out how to do that in an effective manner. So, any of the resources available on our website are available at no cost. I want to make sure that we're all on the same page when we think of what is a comprehensive school mental health system. We are talking about providing a full array of supports and services that, we're focused on mental health promotion, prevention, intervention, consultation. Our goal is to promote positive school climate, social emotional learning, mental health and well-being while reducing the prevalence and severity of mental illness. To do this well, this is not done in isolation. It really takes a village. It takes that team building on the strong foundation of district and school professionals. So our administrators, our specialized instructional support personnel working in partnership with students, family, and community health and mental health partners. And together they're working to address the full array of mental health needs and supports and considering the social and environmental factors that can impact health and mental health. So we have been focused on this multi-tiered system of support as part of our work for many years. I know people are used to seeing 3 tiers. We also find this is all on the foundation of our family, school, community partnerships. We're very focused on making sure that there's adequate professional development and support for our school workforce. But then we have our tier 1, our tier 2, and tier 3. And what we really have been doing as we think about planning for the 2021 school year is using what we know, but then also looking to the implications and considerations, not only related to COVID-19, but implicit bias and structural racism. Some of the things that, as we've been working, now we have a clinical program in Baltimore City and Prince George's County, but we're working with schools and districts throughout the country. And as we've been considering the 2021 school year, one of the things that has come up a lot is to think about some level of a mental health screening, whether it's for all students or figuring out maybe it will be for students who are identified as being at risk. But we know that this has not been a typical series of months since March, and we want to make sure that we're not losing children in the gap. Like, how do we make sure if children are having mental health concerns that we're able to identify them? So potentially considering mental health screening can be important. We also need to make sure that we're screening not only for mental health needs, but some of the social needs. What are some of the social indicators of health? And there are a lot of COVID-19 related assessment measures that have been developed. These are all of the links are active. You can look to some of these measures, but we also want to make sure that whatever is being used to do an assessment, that it's evidence-based, that there's some science behind this. One of the things that we found as we were starting in the spring thinking about how to best work with our families before we could get to some of the mental health concerns. We really needed to deal with the basic needs. Did they have access to a computer? Did they have an internet? Were there food, shelter needs being met before we could go deeper and explore some of the mental health needs? Next slide. Some of the tier 1 strategies that our program has been using and programs throughout the country is thinking about daily check-ins for students. Closegap.org offers free daily check-ins for students that then ultimately can give a dashboard for teachers to look at to see, get a quick snapshot of how students are doing. We also are working with others across the country on how do you integrate SEL curriculum, mindfulness, stress reduction into the classrooms, into small groups. So we want to continue the work that we've been doing. It's going to look a little different, but how do we make sure that we continue to do this? We've also had some success with having some wellness newsletters, using some of the same outreach mechanisms that schools are using. So whether it's the Class Dojo, the school Instagram, Facebook, making sure that families know that we're there and how they can access our support. And I think really critical at the tier 1 strategies is we really need to make sure we're helping our teachers. What if we're not addressing the needs of our education workforce, it's going to be hard for them to support our students. So we definitely have been looking to see what can we do to promote teacher well-being and support during this challenging time. And then we also want to go back to what we know. How do we encourage reassurance, routines, and regulation, even amidst the pandemic? What can we do to help our students, to help our children still have those routines to support just positive regulation? Moving to the next slide, some of the tier 2, tier 3 strategies, one of the most challenging things that we had to face when we moved to tele, and we also moved very quickly. I don't think we've ever moved so quickly on anything ever, but you make it work and you have amazing people and you learn from one another. But coming up with new identification and referral processes. We've been working in schools for many years. We know how to do it in person. But what happens when you're not seeing each other? How do you make sure that, not only can the teacher make a referral, but the administrator, the student could make a referral, a family member. So coming up with new mechanisms to make sure that you don't lose that aspect of the work we do. Maintaining routines from in-person, individual, group, classroom activities. If you are providing mental health services and supports, what are some of the things that you can do that you were doing before? If you had a routine with a student that you were doing individual work, how do you bring some of that to the sessions, even if they're online? So it doesn't have to feel like this is completely different. Adapting, flexibility, those have, that's been in the middle of all of our sentences that we're using. How do we adapt the structure to make sure that we're continuing to provide mental health supports? We know that rates of mental health concerns and problems are, if anything, increasing. How do we make sure that we're adapting the structures that we have to meet the needs that our students are facing? Web-based platforms, I think everyone at this point has been on many, many different platforms, and figuring out which one works best for your program, for your school, for your district, and figuring out there's some fun things that you can do on some of the web platforms. How we've had our clinicians drawing together with their students, watching videos together. Like there's, how do you bring and take advantage of the web platform, going on a scavenger hunt, thinking about different things that can be done that could be fun. And then there was always the challenge of our confidentiality, our consent forms. Our consent forms, we had to think of how do we, when we're not seeing some of the families in person, how do we make sure we can still get consent for the services that we're providing, but also in terms of confidentiality, there may not be a private space for a student in a home. You may not know who's actually in the room when you're working with a student. So even just some simple strategies of if, there could be a signal between a therapist and a student if they're not able to speak, or help them learn to use the chat function if their confidentiality may not be as good as we'd like it to be. Telemental health in schools has been, truly has been our salvation through this. When schools were closed, we worked very hard to reach out to our families, and within 2 weeks, I would say, we were up and running and providing services to our families, but really figuring out, what can we do to make this as user-friendly as possible. There is a science to it. There are strategies to make it, more engaging. And, luckily, some of the rules and regulations had been changed, which allowed us to expand who could provide, what platforms we could use. And that really allowed us to stay connected to our families. One of the things that Kate mentioned that resonated with me is evolving needs and things changing over time. When we first reached out, many of our families said, thank you, but no thanks, because many families, and I'll admit I might have been on this road as well, didn't really think that we were going to be here this long. So when they were just thinking of this as a short break, they weren't as interested in starting services. Oh, we'll just start when we get back to school. But as the weeks have turned into months, going back, keeping that connection. Is it okay if I check back in with you? And being quite persistent. If we had gone with our original no's, we'd have very few families that we'd be able to support. And there's just a wealth of resources. This was really hard to begin to narrow down some of the resources. There are some amazing tools out there. I think it's really important that we learn from each other. There's too much work to be done for us all to keep starting from scratch. Look to see what's out there, adapt it to the populations, to the groups that you're working with. Here's just a few of the resources that are available. And if you go to the next slide, those will, that's just additional resources. And yes, all the slides will be shared, and all the links are clickable so you can access these. In terms of our national centers, our website, we are always looking to make sure we have some of the best resources available. If you have additional resources that we haven't included, you're welcome to send them to me. I'm happy to keep adding them. But our goal is really to kind of do your homework for you and try and pull out some of the best resources that are out there.
Thank you so much. I really appreciate each of your thoughtful comments on what is such a huge topic in an area of such great need. I want to pause here and encourage members of the audience to enter their questions in the Q&A, which you'll see at the bottom of your screen. So we will get to as many questions as we possibly can. But before we do that, to allow folks a little bit of time, I wanted to ask our panelists just some brief questions, and if you can answer briefly, we can move to audience questions as well. But I think there's a couple of things that came up. The first is, Dr. Tooley, can you talk a little bit about sort of the broader landscape of pediatric healthcare during COVID-19, and sort of how do you see school-based health centers playing a role in primary care capacity when we move back into the fall?
Sure, thank you. So I practice at one of the Children's National Outpatient Centers in our community. And I think like many practices, we initially had very few visits coming in. But I am sure many colleagues on the call can relate to now being extremely busy with, lots of people, which is wonderful, coming in for their well child checks now, and, sick visits as well. So, and it's quite busy because we also don't have every single provider in clinic anymore, so that we can maintain some social distancing and some spacing of clinicians and patients and staff, so that we, can maintain a really high level of safety. And I think the biggest change in pediatric care was this flip to, as Dr. Lever was saying, this adoption of telemedicine and telehealth that many places did almost overnight, and really adapted to quite quickly. And I think that's a model that's really here to stay. And also, I think where we can learn so much from our school-based health center counterparts, particularly those in the rural areas. For example, one of our colleagues, Dr. Steve North, runs Health eSchools, a big telehealth platform in a number of states. And so I think we can learn a lot from our colleagues who had been doing telehealth in the school setting for quite some time to ensure that students and families had access to specialists and other services that may not have been immediately available. And I think the other critical role of our school-based health centers is in prevention and screening. So as Dr. Lever and Dr. Connor were mentioning, this is absolutely the time in our primary care settings, our school-based health center settings, and school-based healthcare settings to be checking in with families on what additional needs they have as a result of the pandemic. Are they connected to internet? Do they have a device to learn on if school is going to be via distance learning? What are their needs around food, housing, transportation? And lastly, we all had a big decrease in our visits, which meant a lot of children who need to catch up on vaccines. And so school-based healthcare, through school nursing, through school-based health centers, through health education and case management and many other programs, really plays a critical role in reaching out to families and students, to make sure that we are getting children caught up on their vaccines and providing opportunities for them to do so.
Thanks. Lots of opportunity ahead, but it sounds like it's going to be a very busy transition back to school. Dr. Connor, I realize this is a big question, but I'm curious what you see as sort of the biggest challenge for school-based health centers as we go back to school this fall, whether that's remote or in person, depending on the setting.
Yeah, I think it differs depending on the setting. So I'll start with the all virtual environment, and I think that this really comes back to the issue of the way that place-based healthcare in schools typically improves access for kids and families, which is the kid is already in the school, and so you get to come and get your health services in the school. And thinking about ways to ensure that we are still engaging with our families and still making our services perhaps more accessible than other community based services might be able to be. So I think that really is a big component. In the in-person environment, certainly school-based health center clinicians, as well as school health services staff, and really everyone in the building is going to be very focused on addressing health and safety protocols and responses to prevent potential COVID cases. And so ensuring that school-based health programs are adequately staffed to support that function while also providing the preventive functions, the screenings, the vaccines, et cetera, that school-based health centers are sort of known for, is going to be really critically important. And I think all of this is set against the backdrop of requiring some really finely honed communication between health, education, and public health to identify who's doing what, when, and where, what the student needs are that we're trying to address, and how we can effectively address them.
Lots of coordination for sure. Dr. Lever, can you say a little bit more about what we know? I mean, there's certainly been a lot of discussion around the impact of the pandemic and pandemic-related stressors on students' mental health. Can you talk a little bit about what we know about trends in mental health for kids during the pandemic, if anything, and what do you think of as the key role of schools and school-based mental health programs in that transition back into school, sort of in those first few weeks?
Okay. In terms of trends, again, studies are just coming out. So we're at the beginning in terms of some of the literature, but we know that we're seeing increased rates of anxiety, depression, substance use, suicidal ideation and behaviors, impulse control disorders, trauma. Our youth are losing some of the structures and routines that really help to ground them. And there's a lot of uncertainty in the world right now, which certainly can be anxiety provoking. So we know that rates of some of the disorders and, even child abuse are increasing. In terms of the role of schools and school mental health, we know during typical times, 80% of students who receive mental health services receive them in the school setting. Schools are critical in the identification, the referral, the education of educators around mental health to help with identification and referral. So I do think school mental health through our clinical programs, services, and supports are absolutely critical as we think about returning to school. We need to, think about the needs of the whole child, and mental health is an important part of that. And, not only are we dealing with the needs of the child, but we need support for our educators and the stress that they're experiencing. I mean, this now more than ever, school mental health does matter. And I think will be critical to our, the academic outcomes of our students. If we're not addressing that, we will see decreases in the functioning of our students.
We've had a number of great questions in the chat, and sort of related to that, Dr. Lever, I wondered, we have a question about screening kids for mental health issues and social needs. And the question is, have you thought about ways to practically implement these kinds of screening programs if kids don't return to school in the fall? And sort of how might those translate to the virtual environment?
Some of the questionnaires that I had shared, they could be integrated into some of the school systems. There could be a screening that would, that could be part of a first period or a homeroom class. There could be daily check-ins where a student can report on how they're doing. I think it can easily be integrated into the school day. I think the challenge becomes, if you're going to screen, you need to have the services, supports, and the team ready, your school staff, your community staff ready for referrals and supports for what you find. So you don't want to identify if you don't have strategies and teams in place to do that. But I think, working with your student support teams, it can definitely be integrated. And we can learn from some of the schools that have been doing screening for years. I think we have to be careful not to reinvent everything. Let's see what's already been done that fits what we're doing, and then figure out how to adapt it.
Yes, your point about flexibility is the key, I think is sort of at the core of what we've been talking about. Dr. Tooley, there's a question about sort of how, in your view, do doctors and other healthcare providers feel about kids returning to school in person versus virtual? What are some of the considerations for healthcare providers, and how are healthcare providers making recommendations about this, either to specific schools or to sort of educators more broadly?
So first, I would recommend that people take a look at the American Academy of Pediatrics guidance on return to school, which does place a strong emphasis on the importance of children returning to school in person, with the key being where possible safely. So as Dr. Connor said, we absolutely feel from the AAP standpoint that schools need those resources like personal protective equipment, like staffing, like other supplies, to be able to create as safe a possible environment for children to return to school. And some of the focus on return to school in person really derives from so much of what we spoke about today, which is the huge range of services that are available to children in schools, and that they are at times cut off from if school is not in service. So access to the healthcare can be a challenge. Access to meals, to fitness and other physical activity can be a challenge. That being said, again, the focus is on safety, and we absolutely feel that schools need to be resourced enough to be able to return students and staff safely. And then I would say from, an individual pediatrician standpoint, as I'm having this discussion with many families, although I will give the caveat that in the area that I practice, almost nobody is returning to school in person. It's really not even an option for many of our families, which poses its own challenges. But I usually work with families, through their individual decision making, which includes taking into account, how did your child do with virtual learning? Was it a success for them? Did they blossom? Did they even have access to the device or the internet to do the virtual learning, or were they disconnected for 3 months from their classroom? So really thinking about how it worked for them, how the child is doing with the social isolation posed by virtual learning and the pandemic. What are the family considerations? So what resources that a family may depend on that are most easily available and accessible in school? And then what are the family considerations in terms of the health of the child and the health of other family members at home that may be at increased risk due to COVID infection? So there's a lot of working through it individually with families, but I think at the global scale, schools have to have the resources they need for kids to attend safely. And I think it's important that we recognize that virtual learning is not an equitable experience. People have a variety of access to virtual learning and to quality virtual learning programs. And so we really need to think about what is the best for the child academically and how they can then progress in their education, particularly when we know that masks, hand hygiene, and social distancing or smaller groups make a big difference in the transmission of disease. Ultimately, schools can mitigate risk, but not eliminate risk. And we have to acknowledge that there are also risks for students staying at home with some indefinitely, including some of the major mental health challenges that Dr. Lever pointed out, like isolation and disconnection, depression, and anxiety.
Thank you. I think that one of the things that's coming up in several of the questions is it sounds like many attendees recognize and are enthusiastic about the role of school-based health centers and school-based care for a variety of constituencies. And there's a question about both the ability to serve the needs of teachers and staff in school-based health centers, as well as to serve individuals who are not members of the school community. So there's some concern that with shifting of students from one school to the next, that kids may lose access that they previously had. So Dr. Connor, can you talk a little bit about who has access and how might we be creative about access issues in the future?
Sure, absolutely. And if I could take my moment on the floor just to add to Dr. Dooley's statement, which I completely agree with, that I think safety of kids returning to school also has to do with how the pandemic is being controlled in the local area. And so thinking about ways that government can and local communities can ensure that we are prioritizing kids returning to school over opening up of other activities that may cause upticks in the virus that could prevent us from sending kids back to school is, I think, a critically important piece of this, because how much virus is circulating in the community also has a lot to do with those sort of touch points of when we as clinicians or when parents might feel like it would be okay for their kids to go. To the point of access in school-based healthcare, thanks to folks for raising this. I have always been told that in the world of school-based healthcare, we like to say that if you've seen one school-based health center, you've seen one school-based health center, because they are all very different, and depending on their sponsor, their local district, their local health department, they may have different regulatory environments in terms of whether they can serve students outside of the school and whether they can serve adults. Those things may also come from their sponsor, their sponsoring agency. That being said, there are many school-based health centers that do serve the entire surrounding community, siblings of students in their school, teachers and staff, and particularly during this time when we don't have as many students physically in our buildings in a lot of districts, this is a great opportunity to think about expanding to other communities or other community members. Some considerations that come into play here are, number one, if kids are shifting between different schools and there are multiple different school-based health center operators in your locality, just have to sort of think about how that transition of care happens appropriately. Also, in many instances, we suggest that schools that are going to be serving community members have an external entrance to the school, just so that folks don't have to come through the school in order to enter into the health center. And for some school health centers, that may be a limitation, though it certainly is not required, particularly if there aren't a lot of students in the building. So I think there are a lot of opportunities for this, and this is something that many school-based health centers, I suspect, will be considering, particularly as they may have a lower volume of visits from their kids who are physically in the building.
Great. There are so many interesting questions. I'm sure that we will leave some of them unanswered, but I do want to ask Dr. Lever, are there some decision rules that PCPs, primary care providers, or others parents might use if they have a child with significant mental health symptoms about returning to school? What resources are available for helping providers or parents think through whether or not it's a good idea to send their child back to school?
Mm-hmm. You know, one of the things that providers can do is to really partner with the school-based staff, you know, to connect with the school-based health centers, to connect with your school psychologists, social workers, your community partnered mental health providers, to figure out what could they do to make it safer, more comfortable for the student upon returning. You know, figuring out, you know, what are the symptoms? Is it safe for the student, or do they need, with additional supports, they would be okay? I think it's important that if there's concerns that parents or the primary care providers are having, it would be important to connect them with the school-based staff, with the community partners, to figure out, you know, what supports could be added for that students to help make sure that that the child can be successful.
Well, thank you. I think some of the themes that we've heard about today are that there are lots of options. There's been huge innovation in a really, really short period of time to meet the needs of kids in virtual learning. And while virtual learning has extraordinary limitations for many children, there have been a lot of efforts to try to make that a safer and healthier space, and to connect families and kids with the resources they need inside and outside of school buildings. And I think we are going to continue to do a lot of rapid cycle learning as we try to get kids and teachers safely back into buildings when they're ready to do that. So I'm looking forward to hearing about new innovations that we might be able to carry over to post-pandemic times that will help us better meet the needs of a variety of students and their families and their teachers. So again, I want to say thank you to this phenomenal panel of experts who have given so much of their time both to kids in schools and to school-based healthcare and health services. This is an extraordinary group of folks, and we're lucky to have your expertise. I also want to say thank you to our sponsors, the Johns Hopkins School of Education, the Johns Hopkins Consortium for School-Based Health Solutions, the Berman Institute of Bioethics, and the Rails Center for the Integration of Health and Education. You will be able to find the link to materials as well as to the recording of this webinar on this website at equityschoolplus.jhu.edu. Takes a few days to put the recording up, but it will be available to you at that site if you'd like to review any of the material that we talked about today. My name is Sarah Johnson. I have had the pleasure of moderating this session, and I'm really delighted to end this 7-part series on equity in school reopening. And I want to thank everyone for their time. Thanks again.